The first type of needle which we'll discuss is called the bone marrow aspiration needles. We have two distinct types of needle over here. One is the pen bone blue or pen bone B, another is illy. So first discuss about pen bone blue. This needle has a light T handle similar to that of jump blue. It has lever locking system to control the length of the needle. So the doctor first sets how much to insert the needle to the patient's body through this locking mechanism. As you can see, the more I am moving it, it is either going up or it is going down. So for example, the doctor wants to insert 5 centimeter to the patient's body. So these are 5 different, 1, 2, 3, 4, 5. So 5 centimeter will get inside. So now the doctor holds the needle upright like this. He first identifies in the under the scan that where he wants to insert the needle. It is either in the sternal crests or in the iliac crest of the spinal cord. So now the needle is inserted. After the needle is inserted, this small smart locking system, this cap is opened. The cap is attached to the part called the stylet. The stylet is removed. Now as you can see, the top part is having a lock system. It is called lure lock. Now the needle is already inside the patient's body and it is upright like this. Now a special form of syringe called the lure lock syringe is brought in proximity to the needle and then it is placed in the needle top, and now you can see it is completely locked and there is no point air can come in. So it's completely a vacuum system. Now the needle is inside the patient body and the upper part of the needle is connected to the lure lock syringe. Now what the doctor does, he or she simply aspirates. Now the bone marrow comes in this part. How much you want? Like you want 5 milliliter, then you can just aspirate 5 milliliter. Then this needle is removed and the sample is collected to the specimen collection tube. The tip of this needle is choker tip, or what we call razor cut. As you can see, jump blue is also having razor cut. The benefit of razor cut needle or choker tip is that it causes less trauma to the patients. So the next needle which we have is called the illy. So it is similar in function to that of pen bone blue, but illy is distinctly different in the way it looks. If you focus in the look, illy is having a different kind of handle, which in technical terms is called the ergonomic T handle, or in traditional term also heavy T handle. So how it is different? If you see the hold, the grip of this needle is different to that of pen bone. Pen bone had a very light and thin kind of holding, but it is also preferred by many physicians. Now both of the needle is having the same tip, also called the choker tip. Now for illy, again the doctor has to preset the amount of length the needle will go inside and then he has to put it inside. After that, the smart lock mechanism uses just one gentle push and the stylet comes out. Now as you can see, there is a lure lock, and this lure lock is then fitted with a lure lock syringe, a specialized form of syringe used to aspirate. And now you can just simply aspirate the amount of sample you require, and then it is removed and it is pushed into the specimen collection tube. Now there are two differences between illy and pen bone blue. The first being that the handle is different. It is having ergonomic T handle and it is having light T handle. Second difference is you cannot remove the handle from illy, but in case of pen bone blue, this handle is easily removable. You see, with a gentle push I can remove the handle. This is sometimes useful because when no more inserting is required for the needle, this handle can be removed and the aspiration can be performed without any hassle. The next needle we have is called the harvest needle. So what is harvest needle? It is used for harvesting bone marrow. Bone marrow in the sense it is used for harvesting hemopoietic stem cells from the bone marrow. So how it is performed? As you can see, the needle cannula is having distinct pores inside or holes. This particular variant is having 5 holes. Focus on the tip, 1, 2, 3, and then the other side 2 holes. So when this needle is inserted, first it is inserted into the bone marrow, after which it reaches the crests. Then this stylet is removed. The stylet is having a diamond cut, which is cut from all these ends. This cut is called diamond cut. It is distinctly different from razor cut. So now the needle is like this without the stylet, and only this cannula remains inside the body. Now what the doctor does is called trephining. A needle is then pushed hard, 180 degree and 180 degree, 180 degree and 180 degree, left and right. It is then pushed inside the bone marrow. Now the lower lock syringe is then connected to aspirate what we called the hemopoietic cells, which are not abundantly available. So when aspiration is performed, as you can see, conventionally there is only one hole in the mouth, so only small amount of fluid will come. But since hemopoietic fluid is not that much available in the body, there are more number of holes available. So when one gentle pull is given to the lower lock syringe, a huge amount of fluid comes from all the holes and fills the cavity inside immediately. So it makes the process fast and makes the process even easier to perform. So this is what basically harvesting means, and this is what we have known as the harvest needle. So the next type of needle which I'll talk about is the bone marrow needles. The bone marrow biopsy needles, which is used to collect bone marrow tissues or the solid bone marrow. So these are the 3 types of needle which we have in this series. The first one being Jumblu, this one being Osteoje, and the third one being Presto. These are the 3 focused needle which we have, and out of which Jumblu is the most focused one because it is similar to the innovator brand Jamshidi. So what is the features of Jumblu? First is the tip of Jumblu is trocar tip, as you can see, so it causes less trauma. Second is the tip of Jumblu cannula is beveled. As you can see, to the tip it actually corners a bit from all the sides. So it helps to capture the solid bone marrow easily. So how it is performed? So first, the needle as it is inserted into the patient's body under the guidance of scanning. Now the needle is pushed inside the patient body through the tissues, through the muscles. It reaches the spinal cord, and then the stylage is removed through this smart locking system. Now as you can see, this tip is also having a lower lock. So if the doctor wishes, he or she can aspirate the bone marrow fluid as well. So if, for example, the doctor wishes, so he collects the bone marrow fluid. Then he takes this lower lock syringe and collects the specimen to the specimen collection tube. That part is done. Now the needle along with the cannula is inside the body. For example, this much part is inside the body. So now the soft tissue needs to be collected, or the solid bone marrow needs to be collected. So there we perform a different kind of mechanism called the trephining or the trephine. So now the needle is pushed inside hard using 180 degree left and 180 degree right, and then it is pushed further inside. So now it reaches enough so that it can collect the solid bone marrow. So now after trephining is done, we need to see or check whether the amount of specimen we need is collected or not. Now this is called the sample collecting needle or the specimen collector. So this is now inserted from the top, and using free fall it is just pushed inside, not hard, just free fall. So for example, it gets stuck over here. So now if it gets stuck over here, now we can understand that inside the needle we have specimen already present. For that reason it is not going inside completely. So we have confirmed that the specimen is available inside the cannula. So now the needle is pulled outside from the patient body, again performing 180 degree and 180 degree right and left. So once it is out, this specimen collector is inserted from the tip of the needle, and as it is inserted, it gives a gentle push, and then the specimen is taken out, or it is pushed out from this part of the needle to the specimen collecting tube. So this is how solid bone marrow tissue is being collected. Now another advantage which Jamlu has, the package of Jamlu comes with an extra tip, this, along with this one which is attached to the cannula, the stylet. This another cap is being provided. Why it is provided? Because during the procedure, some doctors may prefer to hammer the needle a bit. So when hammering is needed, for example, it is not going inside, so hammering might be needed. So the needle is pushed inside, the needle is fitted again with the new cap or the spare cap, and then hammering is done from on this part. So it goes inside, and then the hammer can be taken out, and then the rest of the procedure remains same. The next type of needle which we have is called the osteoje. The function is similar to that of Jamlu. It is also used to collect solid bone marrow. So now you can see the difference between Jamlu and osteoje are as follows. First is, Jamlu doesn't have markings in the cannula, but osteoje has. These markings, which you can see, the black markings, these are called echogenic marker. Why they are called echogenic marker? Because they are readable under CT scan or under any form of scans, for example either X-ray or anything like this. So the doctor can have a guidance that how much of the needle is inserted and how much he or she wants to insert. For example, the doctor wants to insert around 10 centimeter. So he or she will count the number of centimeter markings, and then he or she can just refine the needle inside the body, which is not possible in case of Jamlu. But the advantage of Jamlu lies here, that firstly, Jamlu is a lighter needle because it is not having a heavy T handle, but it is having a heavy ergonomic T handle. So the weight of this needle is more than Jamlu. And secondly, Jamlu comes with additional tip. For example, when hammering is required, if this tip breaks, there is another tip. But for osteoje, this plastic is quite of a fragile plastic, as well as it comes only with one cap. So if hammering is required, this needle doesn't come handy. So I won't be explaining the procedure because the procedure is same as of Jamlu. First the needle is inserted, then aspiration if desired can be performed. After that the refining is done, and then the needle is collected. So the sample collection or the specimen collector is different to that of Jamlu. Jamlu was having a kind of J tip. This was the specimen collector of Jamlu. It was having a J type collector. But for osteoje, the collector looks like this. It is more heavy and sturdy, and this has a small stop gap in the upper part. So when it is inserted to check if sample has been collected or not, it stops. It doesn't allow it to go. So these are the two differences. And the grip, as you all know, ergonomic T handle provides better grip. So the grip is better, and the other difference is the cannula tip. As you can see, Jamlu had a bevel type cannula tip, as I have already explained. But for osteoje, you can see it is having a fish mouth. This cutting is called fish mouth cannula tip. This is also used because while trephining, a lot of pressure needs to be applied to cut the tissues inside. So for that reason, this fish mouth technology actually helps in cutting the tissues faster. But also for holding the tissues better, Jamlu is preferred. So next needle in the same series is called the Presto. Now this needle is distinctly different from the other two, namely Jamlu and osteoje. Why it is different? The shape of the needle is similar to that of osteoje. It is having the ergonomic T handle, it is having the echogenic marker. The tip of the needle is also similar to that of osteoje. It is completely diamond cut. But this needle has three parts. Here comes the stylet. Here comes a special form of sample collector. as you can see, the total design of this sample collector is different. It remains inside the needle. And third part is this locking mechanism or the bevel push technology. So I would explain how the process is performed. First, as you all know, the doctor has to identify how much to push it inside. Then the stylet is removed. At this point, if the doctor wishes to perform aspiration, he or she can using the lower lock syringe. After which, the doctor wishes to push inside to collect the solid bone marrow. Now again, trephining is done like this, this and this. As I explained already previously, using that 180 degree movement, trephining is done. After which, the small part over here, this violet part, that is pulled apart to make this small cavity. Now this specimen collecting stylet is pushed further like this. Now the lure lock, there is a lure lock which is available inside the package of Presto. That lure lock is fitted over here so that it locks, it doesn't allow it to pull back. That is fitted. Now the whole thing is pushed inside using trephining. Now when trephining is done, the sample collection tray is then inserted with the specimen collection, the sample collection checking tube, similar to that of which was available in Osteoj. So when it is checked that okay, sample has been collected, it is already present, this part is gently pushed. Now as I pushed it, you can see this sample collection stylet was a bit risen. The moment it gets raised, this can be removed. And now the sample will be available over here. You can get a good amount of sample of around 10 to 15 millimeter sample over here of solid bone marrow. Now the advantage of this technology is, like for any other needle, you cannot perform the process twice or thrice because the needle has to be taken out each and every time. For this needle, you got this sample. You remove this sample to the specimen collection tube. Now you wish to take more sample. Now we push this again, do the trephining, pull this apart, push this inside, then do again trefine more, take this, again collect the sample, you get more amount of sample in the specimen collection stylet. So this is what Presto is about. The other thing remains same, it has echogenic marker and it is one of the most advanced technology biopsy needle available in the market. So the next series of needle which we have is called the soft tissue biopsy needle. We have three types of soft tissue biopsy needle generally in use. The first one being the manual, completely manual needle, which is called the hand cut. Second being the semi-automatic needle, which is called the semi-cut, and the third one being the fully automatic, called the themi needle. So how these needle perform? This needle performs in the particular procedure called the choke-cut biopsy technology. What is choke-cut biopsy technology? The needles have a special cavity in which the soft tissue is captured when the biopsy technology is performed. So for example, if I demonstrate the hand cut. For example, the patient body is having a tumor in the liver. At first the patient needs to be admitted under CT scan to identify the position of the tumor. Then under the CT guidance, this hand cut needle has to be implanted. The needle has to be completely in the retracted position like this, and it has to be inserted in the patient's body under the guidance of CT. For example, the tumor is like in this position, and I insert the needle through the tumor to the tissue, body tissue, and it reaches the tumor tip here. So now this part of the needle, the trigger, is pushed. Now as you can see, as I push the needle, the sample collecting tray got out of the needle cannula. Now the needle is moved a bit and then done a to and fro motion, and then the cannula is again pulled to close the collection tray. Now the needle is softly taken out. after which it is checked that sample has been collected or not by again pushing the cannula, and if the sample is collected, it is taken out through a scalpel in the collection tray. So next type of needle which we have is called the semi-cut or the semi-automatic soft tissue biopsy needle. Now this needle has a trigger, a cannula with echogenic marker and distinct volume marks, that is 10 mm and 20 mm. So how it is performed? The doctor first presets how much volume of sample is required. For example, the doctor requires only 10 mm of the sample. So the trigger is pulled and 10 mm is set. You can feel a gentle feel when 10 mm is reached. And if you want to take 20 mm, just pull it further and again it gets locked in 20 mm. So now the needle is in retracted position with the trigger completely out and retracted. Now at this position the needle is inserted in the patient body under the guidance of CT. As they have echogenic marker, it is visible under the CT. Now it is pushed till the point it reaches the tip of the tumor. For example, it is a pancreatic tumor or it's a bone, it's a breast cancer tumor. Now when it reaches the tumor point, this trigger is then pulled gently till it gets hard. Now as I was pulling, as I was pushing the trigger, as you can see, the tray comes out. So similarly inside the body also, when I push the trigger, the sample collection tray, it penetrates the tumor and gets inside. So the sample collection tray is now visible to the tumor tissues. So now it is already collected. How to capture it? Since it is semi-automatic, no manual labor is needed. You just gently push the trigger further. Now focus on the tip as I push. You hear the click sound. You can assume that the tray is now closed. I'll do that again. The moment you push, the tray gets closed. And since the tray gets closed, we can be rest assured that the sample has been safely collected. Now we take the needle out, again do the similar thing and expose the collection tray. Now you can see the sample sticking to this part, and then we take it out through a scalpel to the sample collection tube. The last needle which we have in this soft tissue biopsy series is called the THEMI or the fully automatic version. So this needle, as you can see, it is quite interesting in the look and also in the feel. It has two triggers. One is in this position, another is in this position. And the sample collection, there is a separate trigger for sample collection, and I'll just explain how the procedure is performed. But unlike semi-cut, it doesn't have volume marking, so you can only collect one volume at a time. You cannot have a choice between 10 mm or 20 mm. At a point, only 10-20 mm is collected. So first, these two trigger is held together and it is pulled. And you can hear the click sound. That means the trigger is now in the retracted position. Now, it depends on the choice of the doctor how he will insert the needle. For example, if it's a breast cancer tumor, doctor prefers to hold it like this, and then under the CT guidance the needle is inserted. Now when the needle is inserted, the doctor can push it once. Now you can see as I pushed once, the sample collection tray got outside, it got exposed. So that means unlike semi-cut or hand cut, I don't have to push the needle ever. It does it automatically. Now since the sample collection tray is outside, now it will be pushed again and the tray will be closed. And it can be performed so fast that this procedure happens like this. And the sample is collected and trapped inside the needle. Now again, for example, the tissue has to be collected from liver tumor. Now the doctor may prefer using this trigger. So once this trigger the needle is inside, again one push, second push, the sample is collected. Now how to collect this specimen? The needle is taken out, then only the lower trigger is pulled. And as you can see, as I am pulling the lower trigger, the sample collection tray is getting exposed. Now holding this lower trigger, now a scalpel can be used to remove the tissue to the specimen collection tube. Okay, the another type of needle which we have is called the coaxial needle, and our coaxial needle is called intro needle. So what is a coaxial needle basically? For example, the doctor needs to perform 2 or more procedures, for example a biopsy as well as a marker insertion, or else making a channel. For example, it depends on the doctor how many procedures he or she wants to perform. For that reason, if we don't use a coaxial needle, we have to perform all the procedures differently in different times, and new insertions to the patient's body has to be done, new prickings, so it is painful as well as hassle for the patients as well as the doctors. So there comes the function of a coaxial needle, which is in the following ways. This needle basically has 2 parts. One is the stylet, which is having a diamond cut. Another is the cannula. So the needle as the full set is inserted in the patient body near the specimen site or the site where the doctor wants to perform the procedures. So the needle is inserted using under the guidance of CT, as it has echogenic marker, it will be visible under the CT. Now when the needle is inserted, the stylet is removed. Once it is removed, as you can see, the entire inside part is completely hollow. So you can perform any procedure from inside the coaxial needle. For example, the needle is inserted, you need to perform a soft tissue biopsy. So you insert the soft tissue biopsy needle and the procedure can be performed, post which you want to insert a marker. So you can use this hollow channel. This is basically creating a channel, this hollow channel, to perform another procedure. So this is how the whole thing is performed. The last type of needle which we have is a cytocut needle, which is used to perform FNAC. The full form of FNAC is fine needle aspiration cytology, and this kind of needle, also called the Chiba needle, traditionally used in the colloquial terms, it is called Chiba needle. So if anyone asks you what is a Chiba needle, you can refer the cytocut needle of MDL. So these needles are basically very fine, and it is used to collect any form of special fluids from the lymph node or the body, and that small amount of fluid is used for testing. So these needles also have echogenic markers, so this can be inserted in the body, and this also comes out, the cannula part, the stylet part comes out and the cannula remains. So the procedure remains the same. So this is how fine needle aspiration cytology is basically done.